Melanoma. Introduction.
Are all tumors cancerous? Select yes or no.
Correct. Only malignant tumors which invade other tissue are cancerous. Benign tumors are not cancerous. Moles are non-cancerous tumors.
Is it always possible to determine the cause of cancer in an individual patient? Select yes or no. Correct. It is typically impossible to specify the cause of cancer in an individual patient, but general causes of cancer are known. Melanoma can happen on any part of the body's skin. Select true or false.
Correct. Black people do not get melanoma.
Select true or false.
Correct. Melanoma is more common in white people than in black people. Every cancerous mole shows changes in symmetry, border, color, and size.
Select true or false. Correct. Some melanomas may only have one or two abnormalities in symmetry, border, color, diameter, or evolution.
Which of the following moles is more likely to be cancerous?
Choose one of the following options. Correct. This mole has less symmetry and an irregular border. During a biopsy, the healthcare provider can remove an abnormal growth surgically. Select true or false. Correct. The healthcare provider can remove the abnormal growth surgically if it is small enough. What is the minimum level of SPF that a sunscreen lotion should have to be effective in protecting from UV radiation? Choose one of the following options. 1. 15. 2. 30. 3. 40.
Correct. A melanoma risk factor is a condition that makes it more likely for a person to have melanoma.
Select true or false. Correct. But it is important to know that most people with one or more melanoma risk factors do not get melanoma. Many people who do get melanoma have none of the risk factors. Thank you for using Explain.